Your dentist won't tell you the truth. Misdiagnosis is happening every day. In the meticulous world of dentistry, precision reigns supreme. Every tooth, a complex structure vital for our well-being. Yet a silent threat lurks in the shadows: misdiagnosis. A missed cavity, a misidentified infection can have life-altering consequences. Imagine the despair of enduring unnecessary procedures, the agony of untreated conditions. This is the reality for countless individuals who fall victim to misdiagnosis in dentistry. The human mouth, a gateway to our overall health. A seemingly small problem can quickly escalate, impacting not just our oral health, but our overall well-being. The stakes are high and the consequences far-reaching. Misdiagnosis, like a crack in a foundation, can weaken the very core of the dentist-patient relationship. Trust, once broken, is difficult to mend. The fear, the uncertainty can linger long after the misdiagnosis is rectified. The dentist's chair, a place where vulnerability meets expertise. We place our trust in these skilled professionals, relying on their knowledge and experience. Accurate diagnosis forms the bedrock of this sacred bond. It's the compass guiding treatment, the roadmap to restoring oral health. Years of rigorous training, countless hours honing their skills. Dentists dedicate their lives to mastering their craft. They understand the intricacies of the oral cavity, the subtle signs of disease, the importance of early detection. Accurate diagnosis is not just a goal, it's an ethical imperative. When diagnosis goes awry, the consequences can be devastating. Unnecessary treatments, missed opportunities for early intervention, and the progression of underlying conditions. The ripple effect extends beyond the dental chair, impacting patients' lives in profound ways. The stories are plentiful, heartbreaking testaments to the human cost of misdiagnosis in dentistry. A young mother misdiagnosed with a simple toothache only to discover a severe infection that spread, requiring extensive surgery. A retired teacher subjected to unnecessary root canal treatment, left with chronic pain and unable to afford corrective procedures. These are not isolated incidents, they are stark reminders of the very real consequences of misdiagnosis. The financial burden, the emotional distress, the physical pain and suffering, the impact on patients' lives can be immeasurable. It's time to shed light on this critical issue, to understand the factors contributing to misdiagnosis in dentistry. By examining the role of outdated technology, we can begin to chart a course towards a future where accurate diagnosis is the rule, not the exception. Dentistry, though a science, is not immune to the fallibility of human judgment. Even the most skilled hands, the sharpest minds, can err. Visual inspection, a cornerstone of diagnosis, relies on subjective interpretation. A subtle discoloration, a minute crack can be easily overlooked. The human eye, for all its wonders, has limitations. What one dentist perceives as a minor anomaly, another might interpret as a cause for concern. Experience plays a crucial role, but even seasoned dentists can fall prey to perceptual biases. Fatigue, distractions, time constraints. These factors can further cloud judgment. In a busy practice, the pressure to see multiple patients can compromise the time devoted to thorough examination. Every decision a dentist makes carries weight, and even seemingly small oversights can have significant ramifications. Shadow of bias, when assumptions cloud judgment. The human mind, while remarkable, is prone to shortcuts. We make assumptions based on past experiences, preconceived notions, even cultural biases. In dentistry, these cognitive biases can lead to misdiagnosis. A patient's age, appearance, or even their demeanor can subtly influence a dentist's perception. Consider the case of a young patient presenting with tooth sensitivity. The assumption might be that it's due to aggressive brushing or dietary factors. However, a more serious underlying condition, such as a cracked tooth or enamel erosion, could be overlooked. Similarly, cultural beliefs about oral health can impact both the patient's description of symptoms and the dentist's interpretation. What might be considered a minor discomfort in one culture could be a cause for serious concern in another. Bridging these cultural gaps is crucial for accurate diagnosis. Time, the enemy of precision, the pressure of a fast-paced world. Modern dentistry operates in a world of efficiency and high patient volume. While this allows for greater access to care, it also places immense pressure on dentists. Time constraints can lead to rushed examinations, limiting the opportunity for thorough investigation and comprehensive diagnosis. The temptation to rely on quick assessments to prioritize speed over meticulousness can be strong. However, it is in these moments of haste that crucial details can be missed. A seemingly insignificant symptom, if not fully explored, can be a sign of a more serious underlying issue. Furthermore, limited appointment slots can make it challenging for patients to fully articulate their concerns. They may feel rushed, hesitant to interrupt, or unsure how to describe their symptoms accurately. This communication breakdown can further hinder the diagnostic process. Communication breakdown, the unspoken language barrier. Effective communication forms the bedrock of the dentist-patient relationship. However, language barriers, cultural differences, and even fear and anxiety can impede open dialogue. Patients may struggle to articulate their symptoms accurately, while dentists may misinterpret nonverbal cues. Dental terminology, often complex and technical, can be difficult for patients to understand. They may hesitate to ask clarifying questions, fearing they will appear unknowledgeable. This can lead to misunderstandings and ultimately misdiagnosis. Moreover, cultural norms around pain expression and healthcare-seeking behaviors can influence how patients present their symptoms. Some cultures encourage stoicism, leading patients to downplay their discomfort. Others may emphasize the severity of symptoms, potentially masking the true nature of the problem. For decades, X-rays have been the workhorse of dental diagnostics, offering a glimpse into the hidden structures of our teeth and jaws. Yet, traditional X-rays, while invaluable, provide only a limited perspective. Like a shadow puppet show, they offer a two-dimensional representation of a three-dimensional reality. Imagine trying to navigate a complex maze using only a map showing a single view. You might see walls and pathways, but their true relationships, their depth and intricacies would remain hidden. Similarly, traditional X-rays can obscure crucial details, leading to misinterpretations and misdiagnosis. Overlapping structures, distortions caused by patient positioning, and the inherent limitations of two-dimensional imaging all contribute to the potential for error. A small cavity hidden between teeth, a hairline fracture obscured by surrounding bone, these subtle but crucial details can easily be missed. The human mouth, a marvel of intricate design, exists in three dimensions: teeth, nerves, blood vessels, all interwoven in a complex tapestry. Traditional X-rays, by their very nature, flatten this intricate reality into a two-dimensional plane. This loss of depth perception can have profound implications for diagnosis. Consider the placement of dental implants, a common procedure requiring precise assessment of bone density and surrounding structures. A traditional X-ray might suggest sufficient bone, but fail to reveal a critical nerve canal hidden from view. The consequences of such an oversight can be severe, leading to nerve damage, chronic pain, and the need for costly corrective surgeries. Furthermore, traditional X-rays offer limited information about soft tissues such as gums, ligaments, and the temporomandibular joint. Conditions affecting these structures, often accompanied by subtle changes not visible on X-rays, can be easily misdiagnosed or overlooked entirely. Outdated dental equipment, like a rusty compass, can lead us astray. While traditional tools have served us well, their limitations become increasingly apparent in the face of modern dental challenges. The illusion of precision offered by these outdated instruments can lull us into a false sense of security, masking the subtle signs of disease. Take, for example, the periodontal probe, a staple instrument for measuring gum pockets, an indicator of gum disease. Traditional probes, often marked in millimeters, can provide a general assessment of pocket depth. However, they lack the sensitivity to detect subtle changes in gum tissue, the early warning signs of periodontal disease. Similarly, outdated drills, lacking the precision and control of modern counterparts, can cause unnecessary damage to healthy tooth structure. This can weaken the tooth, making it more susceptible to future problems and potentially leading to costly and invasive procedures down the line. A legacy of neglect, the high cost of technological stagnation. The rapid evolution of technology has revolutionized countless fields, yet, dentistry has, in some ways, lagged behind. While advancements have been made, the widespread adoption of cutting-edge technology has been slow, hindered by factors such as cost, lack of awareness, and resistance to change. This technological stagnation has come at a cost, perpetuating the cycle of misdiagnosis and its associated consequences. Investing in modern dental technology is not merely about keeping up with the latest trends, it's about providing the highest standard of care for patients. Upgrading to digital X-rays, incorporating three-dimensional imaging and utilizing advanced diagnostic tools, these are not luxuries but necessities for accurate diagnosis and effective treatment. The human cost of outdated technology is immeasurable. Unnecessary pain and suffering, financial strain from misdiagnosis and ineffective treatment, and a loss of trust in the dental profession. By embracing technological advancements, we can break free from this legacy of neglect and usher in a new era of precision and patient-centered care in dentistry. Beyond the chair, the ripple. Effect of misdiagnosis on patients' lives. The impact of misdiagnosis in dentistry extends far beyond the dental chair. It ripples through patients' lives, affecting their physical health, their emotional well-being, their financial stability, and their trust in healthcare professionals. The consequences can be profound and long-lasting. Physically, misdiagnosis can lead to unnecessary pain and suffering, the progression of underlying conditions, and the need for more invasive and costly treatments down the line. The emotional toll can be equally devastating, leading to anxiety, depression, and a sense of betrayal. Financially, misdiagnosis can result in wasted expenses on ineffective treatments, the need for corrective procedures, and lost wages due to time off from work. Furthermore, the erosion of trust in healthcare providers can have long-term consequences, making individuals hesitant to seek timely care in the future. Embracing the digital age. The rise of advanced imaging. The world of dentistry is on the cusp of a technological revolution. Gone are the days of relying solely on two-dimensional X-rays and subjective interpretations. Advanced imaging techniques like a beacon cutting through the fog are illuminating the once hidden complexities of the oral cavity. Digital dentistry, with its precision and clarity, is transforming the diagnostic landscape. Cone beam computed tomography, or CBCT, a sophisticated imaging technique, provides three-dimensional representations of teeth, bones, and surrounding tissues. This allows dentists to visualize anatomical structures with unparalleled detail, facilitating more accurate diagnosis and treatment planning. Imagine being able to rotate a tooth on a computer screen, examining it from every angle, peering into its innermost canals. This is the power of CBCT, enabling dentists to detect subtle fractures, assess bone density for implant placement, and identify anatomical variations that might otherwise go unnoticed. beyond the naked eye diagnostic tools of the future. The quest for early detection and precise diagnosis is driving innovation in dental technology. New tools like finely tuned instruments in the hands of a skilled artisan are emerging to complement the dentist's expertise. These advancements hold the promise of minimizing human error and improving patient outcomes. Caries detection devices, utilizing fluorescence technology, can identify early signs of tooth decay invisible to the naked eye. These handheld devices illuminate teeth with a specific wavelength of light, causing bacteria and demineralized enamel to fluoresce, alerting dentists to areas requiring attention. Intraoral cameras, small pen-like devices with built-in cameras, provide magnified views of the oral cavity. These images, displayed on a screen, allow patients to see what the dentist sees, fostering greater understanding and engagement in their own oral health. A paradigm shift towards patient-centric care. The future of dentistry is not just about technological advancements, it's about shifting the paradigm towards patient-centric care. This means moving away from a purely clinical approach to one that prioritizes open communication, patient education, and shared decision-making. Imagine a dental appointment where the dentist takes the time to listen attentively to your concerns, explaining your diagnosis in clear, understandable language. They show you images of your teeth, discuss treatment options, and empower you to make informed decisions about your own oral health. This patient-centric approach fosters trust, reduces anxiety, and leads to better treatment adherence. When patients feel heard, understood, and respected, they are more likely to follow through with recommended treatments and maintain good oral health in the long run. Bridging the gap: education, awareness, and advocacy. Closing the gap in misdiagnosis requires a multi-pronged approach. It demands a commitment to ongoing education for dental professionals, raising public awareness about the importance of oral health, and advocating for policies that promote access to quality dental care. Dental schools and continuing education programs must prioritize training in the latest diagnostic technologies and techniques. Dentists need to stay abreast of advancements in their field, embracing new tools and incorporating them into their practice. Public awareness campaigns can educate individuals about the importance of regular dental checkups, the early signs of oral health problems, and the risks associated with delaying treatment. Empowered with knowledge, patients can become active participants in their own oral health care. Finally, advocating for policies that expand access to dental insurance, support research and development in dental technology, and address disparities in oral health care can create a system where everyone has the opportunity to achieve optimal oral health. Securing the future of oral health care. The tales we have unveiled are not mere anecdotes, they are stark reminders of the human cost of complacency. Misdiagnosis in dentistry, often fueled by outdated technology and systemic shortcomings, has left countless individuals grappling with avoidable pain, unnecessary expenses, and a diminished quality of life. Ignoring this issue is akin to neglecting a crack in a bridge, a recipe for disaster. The time for action is now. We must demand better for ourselves and future generations. This requires a multifaceted approach, a collective effort from dental professionals, policymakers, and the public alike. Investing in cutting-edge technology is not a luxury, it's a necessity. Embracing digital dentistry with its precision and clarity can significantly reduce diagnostic errors and enhance treatment outcomes. This means equipping dental practices with advanced imaging systems, caries detection devices, and other tools that empower dentists to see beyond the naked eye. Towards a brighter smile, embracing precision and partnership. Technology alone, however, is not enough. We must also cultivate a culture of patient-centric care within dentistry. This begins with fostering open communication between dentists and patients. Dentists must prioritize listening to their patients' concerns, explaining diagnoses in clear, understandable language, and involving them in treatment decisions. Patients, in turn, must be proactive about their oral health. This includes scheduling regular dental checkups, being attentive to changes in their mouth, and asking questions about their diagnosis and treatment options. Open dialogue and shared decision-making are the cornerstones of a strong dentist-patient partnership. The journey towards eliminating misdiagnosis in dentistry is an ongoing one. It requires continuous learning, adaptation, and a steadfast commitment to putting patients first. By embracing technological advancements, fostering patient-centric care, and advocating for policies that promote oral health equity, we can create a future where everyone can smile with confidence, knowing their oral health is in good hands. Towards a brighter smile, embracing precision and partnership. Technology alone, however, is not enough. We must also cultivate a culture of patient-centric care within dentistry. This begins with fostering open communication between dentists and patients. Dentists must prioritize listening to their patients' concerns, explaining diagnoses in clear, understandable language, and involving them in treatment decisions. Patients, in turn, must be proactive about their oral health. This includes scheduling regular dental checkups, being attentive to changes in their mouth, and asking questions about their diagnosis and treatment options. Open dialogue and shared decision-making are the cornerstones of a strong dentist-patient partnership. The journey towards eliminating misdiagnosis in dentistry is an ongoing one. It requires continuous learning, adaptation, and a steadfast commitment to putting patients first. By embracing technological advancements, fostering patient-centric care, and advocating for policies that promote oral health equity, we can create a future where everyone can smile with confidence, knowing their oral health is in good hands. Pause 7S. Governments play a very important role in supporting dentists by implementing favorable tax policies that help them adopt new technologies and replace outdated equipment. Additionally, banks can assist by offering low-interest loans with grace periods, making it financially viable for dental practices to upgrade their tools and infrastructure. Insurance companies also have a crucial part to play. By streamlining the insurance process to make it faster, online, and easier, they can support both dentists and patients alike. These collective efforts can significantly ease the financial burden on dental professionals, fostering an environment where advanced diagnostic and treatment options are accessible to all. Together, with the support of government, financial institutions, and insurers, we can drive forward a new era of precision and partnership in oral healthcare.